Question 1. Assessment of the most effective process optimization strategy for delivering mental health and psychosocial support, MHPSS, in the immediate aftermath of a large-scale natural disaster, considering limited resources and diverse affected populations, would prioritize which of the following? Option A. Deploying all available specialized mental health clinicians to provide individual therapy to as many affected individuals as possible within the first 48 hours. Option B. Relying solely on international non-governmental organizations to deliver all MHPSS interventions, bypassing local healthcare infrastructure and community leaders. Option C. Implementing a phased approach that begins with psychological first aid and community-based support, gradually escalating to specialized clinical services as needs are identified and resources allow. Option D. Focusing exclusively on establishing formal mental health clinics and psychiatric services to address the anticipated widespread mental illness. The correct answer is C. Implementing a phased approach that begins with psychological first aid and community-based support, gradually escalating to specialized clinical services as needs are identified and resources allow. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing immediate crisis response with long-term mental health needs in a disaster setting. Healthcare professionals must rapidly assess and prioritize limited resources for psychosocial support, ensuring that interventions are culturally sensitive, evidence-based, and adaptable to the evolving needs of a diverse affected population. The dynamic nature of disasters means that needs can change quickly, demanding continuous reevaluation and flexibility in service delivery. Correct approach analysis. The correct approach emphasizes a phased, needs-driven, and integrated model of mental health and psychosocial support, MHPSS. This aligns with established disaster response frameworks, such as those promoted by the World Health Organization, WHO, and the Sphere Standards, which advocate for a tiered approach starting with basic safety and security, followed by community-based support, and then specialized services for those with more severe conditions. This approach prioritizes immediate psychological first aid, focuses on strengthening community coping mechanisms, and ensures that more intensive interventions are available for those who require them, thereby optimizing resource allocation and maximizing positive outcomes across the affected population. It also promotes a continuum of care, recognizing that recovery is a process. Incorrect approaches analysis. One incorrect approach would be to immediately deploy highly specialized mental health professionals to provide individual therapy to all affected individuals. This is an inefficient use of scarce resources. In the initial phase of a disaster, it fails to address the most pressing needs for safety, basic comfort, and community support, which are foundational for psychological well-being. Ethically, it neglects the principle of distributive justice by potentially diverting specialized expertise from those who might benefit most from it later, while failing to provide basic support to the broader population. Regulatory frameworks for disaster response typically mandate a tiered, population-level approach before escalating to individual specialized care. Another incorrect approach would be to solely rely on external aid organizations to provide all MHPSS, neglecting the vital role of local community structures and existing healthcare providers. This approach undermines local capacity building and sustainability, and can lead to interventions that are not culturally appropriate or contextually relevant. It fails to leverage existing social capital and trust within communities, which are crucial for effective psychosocial support. Ethically, it can lead to a dependency on external aid and a failure to empower local responders. Regulatory guidelines for disaster management emphasize the importance of integrating local resources and building local capacity. A third incorrect approach would be to assume that all individuals will require formal mental health treatment post-disaster, leading to an overemphasis on clinical interventions. This overlooks the resilience of individuals and communities and the effectiveness of non-clinical support mechanisms. It can lead to unnecessary medicalization of distress and strain on formal mental health systems. Best practices in disaster mental health recognize that most individuals will experience transient distress and can recover with appropriate support, without needing formal psychiatric diagnosis or treatment. Regulatory guidance focuses on a spectrum of care, not solely clinical interventions. Professional reasoning. Professionals should adopt a systematic, evidence-based approach to MHPSS in disasters. This involves: 1. Rapid needs assessment to understand the immediate psychosocial impact and identify priority groups. 2. Implementing psychological first aid to provide immediate comfort and support. 3. Strengthening community-based support systems and promoting self-care and mutual support. 4. Establishing referral pathways for individuals requiring specialized care. 5. Continuously monitoring and evaluating the effectiveness of interventions and adapting strategies as needs evolve. This process ensures that resources are used effectively, interventions are appropriate to the phase of the disaster, and the principles of ethical and effective disaster response are upheld. Question 2. Comparative studies suggest that healthcare organizations face significant challenges in effectively allocating resources for disaster preparedness. When faced with a comprehensive list of identified risks, ranging from natural disasters to technological failures and public health emergencies, what is the most professionally sound approach to prioritizing mitigation efforts? Option A. Focus mitigation efforts primarily on the types of disasters that have historically occurred most frequently in the organization's region, as past patterns are the most reliable indicators of future threats. Option B. Implement mitigation strategies for any identified risk that can be addressed with readily available resources or at a low cost, ensuring that some level of preparedness is achieved across all identified vulnerabilities. Option C. Allocate resources to address the most dramatic or widely publicized disaster scenarios, as these represent the most significant potential threats to public perception and organizational reputation. Option D. Systematically assess each identified risk based on its likelihood of occurrence and the potential severity of its impact on patient care, staff safety, and organizational operations, then prioritize mitigation efforts accordingly. Correct answer is D. Systematically assess each identified risk based on its likelihood of occurrence and the potential severity of its impact on patient care, staff safety, and organizational operations, then prioritize mitigation efforts accordingly. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare disaster preparedness, balancing limited resources against a wide spectrum of potential threats. The professional challenge lies in prioritizing mitigation efforts when faced with numerous identified risks, each with varying probabilities and potential impacts. Effective judgment is required to allocate resources strategically, ensuring the most critical vulnerabilities are addressed without neglecting other significant threats. This necessitates a systematic and evidence-based approach, moving beyond anecdotal evidence or personal bias. Correct approach analysis. The correct approach aligns with the principles of robust risk management frameworks often mandated or recommended by healthcare disaster preparedness guidelines. It emphasizes a data-driven, systematic evaluation of identified risks. This involves quantifying or qualitatively assessing the likelihood of each hazard occurring and the potential severity of its impact on patient care, staff safety, and organizational operations. By prioritizing risks based on a combination of likelihood and impact, healthcare organizations can focus their mitigation efforts on the most significant threats, thereby maximizing the effectiveness of their preparedness investments. This systematic approach ensures that decisions are defensible, transparent, and aligned with regulatory expectations for disaster preparedness, such as those outlined by relevant U.S. federal agencies, e.g., HHS, FEMA, and professional bodies. It promotes a proactive stance, moving from a reactive to a preventive or mitigating posture. Incorrect approach is analysis, focusing solely on the most frequently occurring historical incidents, without considering their potential severity or the evolving threat landscape, represents a failure to conduct a comprehensive risk assessment. This approach can lead to underpreparedness for rare but catastrophic events. It also ignores the potential for new or emerging threats that may not have a significant historical record. Prioritizing mitigation efforts based on the most sensational or widely publicized disaster scenarios, irrespective of their actual likelihood or relevance to the specific healthcare facility's geographic location and operational context, is an emotionally driven and unprofessional approach. This can lead to misallocation of resources towards low-probability, low-impact events, while neglecting more probable and impactful risks. It fails to adhere to the principle of evidence-based decision-making and can be seen as a deviation from best practices in risk management. Implementing mitigation strategies only for risks that are easily or cheaply addressed, without a thorough assessment of their actual risk level, is a fiscally driven but ultimately flawed strategy. This approach prioritizes convenience and cost-effectiveness over genuine risk reduction, potentially leaving the organization vulnerable to significant harm. It bypasses the critical step of risk prioritization, which is essential for effective resource allocation and ensuring the organization's resilience. Professional reasoning. Professionals should employ a structured decision-making framework for risk assessment and mitigation. This typically involves 1. Hazard identification, systematically identifying all potential threats to the healthcare organization. 2. Risk analysis, assessing the likelihood of each hazard occurring and the potential severity of its impact. This can involve qualitative e.g., high, medium, low, or quantitative methods. 3. Risk evaluation, prioritizing risks based on their analysis, often using a risk matrix that plots likelihood against impact. 4. Risk treatment, developing and implementing strategies to mitigate, transfer, avoid, or accept identified risks. 5. Monitoring and review, regularly reviewing and updating the risk assessment and mitigation plans to account for changes in the threat landscape, organizational capabilities, and lessons learned. This iterative process ensures that preparedness efforts are dynamic, evidence-based, and aligned with the organization's specific vulnerabilities and the regulatory environment. Question 3. Stakeholder feedback indicates that following a recent significant public health emergency, the healthcare organization's disaster management team is reviewing its performance to best align with the National Healthcare Disaster Certification Framework and ensure future resilience. Which of the following actions demonstrates the most effective integration of lessons learned? Option A. Prioritizing the immediate restoration of services and patient care without establishing a structured process to capture and analyze the operational experiences of the recent disaster. Option B. Immediately reallocating resources to acquire new equipment and enhance training for potential future disasters without a formal review of the recent event's operational effectiveness. Option C. Focusing exclusively on long-term mitigation projects for entirely hypothetical threats while deferring analysis of the recent emergency's impact and response. Option D. Systematically documenting all observed challenges and successes during the response and recovery phases, and then developing specific, actionable improvements to be incorporated into the organization's preparedness plans and mitigation strategies for future events. The correct answer is D. Systematically documenting all observed challenges and successes during the response and recovery phases, and then developing specific, actionable improvements to be incorporated into the organization's preparedness plans and mitigation strategies for future events. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing immediate operational needs during a disaster with long-term strategic planning for future events. Healthcare organizations must demonstrate compliance with the National Healthcare Disaster Certification Framework, which emphasizes a cyclical approach to disaster management. The challenge lies in prioritizing actions that address immediate life-saving efforts, while simultaneously ensuring that lessons learned are integrated into future preparedness and mitigation strategies, thereby avoiding a reactive rather than a proactive stance. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the core principles of the National Healthcare Disaster Certification Framework. This framework mandates a continuous improvement cycle across all phases of disaster management: preparedness, response, recovery, and mitigation. By focusing on integrating lessons learned from the recent event into the preparedness phase for future disasters, the organization is proactively strengthening its resilience. This demonstrates a commitment to not only responding effectively, but also to learning from experience and systematically reducing future risks, which is a cornerstone of robust disaster management and regulatory compliance. Incorrect approaches analysis. One incorrect approach fails to acknowledge the interconnectedness of disaster management phases, focusing solely on immediate recovery without a structured process to capture and analyze lessons learned for future preparedness, neglects the mitigation and preparedness phases. This reactive approach increases the likelihood of repeating past mistakes and failing to meet the comprehensive requirements of the National Healthcare Disaster Certification, which stresses proactive planning and risk reduction. Another incorrect approach prioritizes immediate resource allocation for future preparedness without a formal review of the recent event. This overlooks the critical recovery phase and the valuable insights gained from actual response efforts. Without understanding what worked and what didn't during the recent disaster, preparedness efforts may be misdirected, inefficient, and ultimately ineffective, failing to address the specific vulnerabilities exposed by the event, and thus not meeting the spirit or letter of the certification requirements. A third incorrect approach might involve solely focusing on mitigation efforts for entirely new hypothetical threats without adequately addressing the lessons from the recent, real-world event. While mitigation is crucial, neglecting to analyze and incorporate learnings from a recent disaster into preparedness and future mitigation plans is a significant oversight. It suggests a failure to learn from experience, which is a fundamental expectation of the National Healthcare Disaster Certification and a critical component of effective disaster management. Professional reasoning. Professionals should adopt a systematic, cyclical approach to disaster management. This involves 1. Actively participating in and documenting all phases of disaster management: preparedness, response, recovery, mitigation. 2. Establishing a formal process for debriefing and analyzing the effectiveness of actions taken during and after a disaster. 3. Identifying specific lessons learned and actionable improvements. 4. Integrating these lessons into updated preparedness plans, training exercises, and mitigation strategies. 5. Regularly reviewing and updating all disaster management plans to reflect current threats, best practices, and organizational learning. This iterative process ensures continuous improvement and compliance with regulatory frameworks like the National Healthcare Disaster Certification. Question 4. To address the challenge of establishing a robust disaster management program that meets the National Healthcare Disaster Certification requirements, which of the following best defines the scope of disaster management for a healthcare facility? Option A. A single, comprehensive planning document that is developed and updated annually. Option B. The immediate actions taken to respond to an emergency event once it has occurred. Option C. The procurement and maintenance of essential medical equipment and supplies for emergency situations. Option D. A continuous cycle of planning, training, exercising, evaluating, and improving all aspects of preparedness, response, and recovery activities. The correct answer is D. A continuous cycle of planning, training, exercising, evaluating, and improving all aspects of preparedness, response, and recovery activities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare facility to define and operationalize the scope of its disaster management program within the context of the National Healthcare Disaster Certification (NHDC) framework. The challenge lies in accurately interpreting the NHDC guidelines on what constitutes disaster management to ensure comprehensive preparedness, response, and recovery capabilities, while also aligning with the facility's specific operational realities and resource constraints. Misinterpreting the scope can lead to critical gaps in preparedness, leaving the facility vulnerable during an actual event and potentially failing to meet regulatory expectations. Correct approach analysis. The correct approach represents best professional practice because it directly aligns with the core principles and regulatory intent of the NHDC. The NHDC emphasizes a holistic and integrated approach to disaster management, encompassing all phases from mitigation and preparedness through response and recovery. By defining disaster management as a continuous cycle of planning, training, exercising, and evaluating, the facility demonstrates an understanding of the dynamic nature of disaster preparedness. This approach ensures that the program is not a static document, but a living entity that evolves based on lessons learned and changing threats. This aligns with the NHDC requirement for robust, evidence-based, and adaptable disaster management plans that are regularly tested and improved. It also reflects the ethical obligation of healthcare facilities to protect patient safety and maintain operational continuity during emergencies. Incorrect approaches analysis. An approach that defines disaster management solely as the immediate response to an event fails to acknowledge the crucial pre-event mitigation and preparedness activities, as well as the essential post-event recovery and mitigation phases. This narrow definition is a significant regulatory failure under the NHDC, which mandates a comprehensive life cycle approach. Ethically, it prioritizes immediate action over proactive risk reduction and long-term resilience, potentially leading to inadequate resources and planning for the most critical phases. An approach that limits disaster management to only the acquisition of specific equipment and supplies overlooks the equally vital components of human resources, training, communication protocols, and community coordination. NHDC requires a multifaceted approach that addresses all aspects of disaster readiness. This limited scope represents a regulatory failure by neglecting essential non-material preparedness elements and an ethical failure by potentially creating a false sense of security based on material assets alone, without the trained personnel to utilize them effectively. An approach that views disaster management as a one-time planning exercise, completed and filed away, is fundamentally flawed. The NHDC expects ongoing engagement, regular drills, and continuous improvement. This static view is a clear regulatory violation, as it implies a lack of commitment to maintaining and enhancing disaster readiness. Ethically, it is irresponsible, as it fails to account for evolving threats, changes in facility operations, or lessons learned from exercises or real-world events, thereby compromising the ability to protect patients and staff. Professional reasoning. Professionals should adopt a decision-making process that begins with a thorough review of the specific regulatory framework, in this case, the NHDC guidelines. This involves understanding the explicit definitions and expectations for disaster management. Following this, they should assess the facility's current capabilities and identify any gaps relative to the regulatory requirements. The process should then involve developing a comprehensive plan that addresses all phases of disaster management, integrating it into the facility's overall operations, and establishing mechanisms for regular training, testing, and evaluation. Continuous improvement should be a cornerstone, ensuring the plan remains relevant and effective. Question 5. The monitoring system demonstrates a widespread and prolonged power outage affecting critical life support systems within the healthcare facility, directly attributable to the failure of the facility's backup generator system during a severe, unexpected blizzard that overwhelmed local power grids. Option A, hybrid disaster. Option B, natural disaster. Option C, technological disaster. Option D, human-made disaster. The correct answer is C, technological disaster. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the healthcare disaster certification holder to accurately categorize a complex event that exhibits characteristics of multiple disaster types. Misclassification can lead to inappropriate resource allocation, ineffective response strategies, and potential regulatory noncompliance, impacting patient care and organizational preparedness. The challenge lies in discerning the primary driver of the event and its cascading effects within the specific regulatory framework of the National Healthcare Disaster Certification. Correct approach analysis. The correct approach involves identifying the primary cause of the disruption and its immediate consequences. In this case, the widespread power outage directly impacting critical life support systems, even if triggered by a severe weather event, represents a technological failure within the healthcare facility's infrastructure. The National Healthcare Disaster Certification Framework emphasizes preparedness for various disaster types, including technological failures that can arise from or be exacerbated by natural events. Therefore, classifying this as a technological disaster, while acknowledging the natural trigger, allows for the most targeted and effective response planning related to backup power systems, generator maintenance, and redundant infrastructure, aligning with best practices for ensuring continuity of care during such disruptions. Incorrect approach is analysis. One incorrect approach is to solely classify this as a natural disaster. While a severe weather event initiated the chain of events, the core failure that directly threatened patient lives was the failure of the technological infrastructure, power supply. Focusing only on the natural aspect might lead to an overemphasis on external mitigation, e.g., weather forecasting, and underemphasis on internal resilience measures like generator capacity and fuel supply, which are critical for technological disaster response. This neglects the specific requirements for addressing infrastructure failures as outlined in disaster preparedness guidelines. Another incorrect approach is to classify it as a human-made disaster. This would imply intentional sabotage or gross negligence in the operation of the power grid or facility systems, which is not indicated by the scenario. Misclassifying it as human-made could lead to unnecessary investigations into malicious intent, diverting resources and attention from the immediate need to restore power and ensure patient safety. It also fails to acknowledge the role of the natural event as a contributing factor. A further incorrect approach is to categorize it as a hybrid disaster without further specificity. while it has elements of both natural and technological disaster. The National Healthcare Disaster Certification Framework typically requires a primary classification to guide specific preparedness and response protocols. Acknowledging the hybrid nature is important for comprehensive planning, but the immediate operational challenge stems from the technological failure, making that the most actionable classification for immediate response. Professional reasoning. Professionals should approach such scenarios by first identifying the immediate cause of the critical failure impacting healthcare operations. They must then consider the primary driver of that failure. The National Healthcare Disaster Certification Framework provides guidance on classifying disasters to ensure appropriate preparedness and response. In situations with overlapping causes, the classification should reflect the most direct threat to patient care and the most actionable area for immediate intervention and mitigation. This involves a systematic evaluation of the event's characteristics against the defined categories within the certification scope, prioritizing the classification that enables the most effective and compliant response. Question 6. Market research demonstrates that healthcare organizations often struggle to prioritize components within their emergency response plans. Considering the National Healthcare Disaster Certification's emphasis on operational continuity and patient safety during catastrophic events, which of the following components, if absent or ineffective, would most severely cripple an organization's ability to initiate and sustain a coordinated response? Option A. The development of detailed, predetermined evacuation routes and procedures for all facility areas. Option B. The implementation of a robust patient tracking system to account for all individuals within the facility. Option C. The establishment of clear, redundant, and multimodal communication channels and protocols among internal staff, external agencies, and the public. Option D. The acquisition and secure storage of a comprehensive inventory of critical medical supplies and pharmaceuticals. The correct answer is C. The establishment of clear, redundant, and multimodal communication channels and protocols among internal staff, external agencies, and the public. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare organization to balance immediate operational needs with long-term preparedness, all while adhering to the stringent requirements of the National Healthcare Disaster Certification. The core challenge lies in identifying which component of an emergency response plan is most critical for initial activation and sustained effectiveness during a disaster, a decision that directly impacts patient safety and organizational resilience. Misjudging this priority can lead to critical gaps in response capabilities, potentially resulting in loss of life, compromised care, and significant regulatory penalties. Careful judgment is required to prioritize foundational elements that enable all other aspects of the response. Correct approach analysis. The correct approach emphasizes the establishment of clear communication channels and protocols. This represents best professional practice because effective, reliable, and redundant communication is the bedrock of any coordinated emergency response. The National Healthcare Disaster Certification, like many disaster preparedness frameworks, implicitly or explicitly mandates robust communication systems. Without the ability to disseminate information, coordinate actions, and receive situational updates, all other components of the plan, such as resource management or evacuation procedures, become ineffective. This aligns with ethical obligations to ensure patient safety through coordinated care and regulatory requirements for continuity of operations and information flow during emergencies. Incorrect approaches analysis. One incorrect approach focuses solely on stockpiling medical supplies. While essential, this is not the most critical initial component. Regulatory failures occur because a large supply cache is useless if it cannot be accessed, distributed, or accounted for due to a lack of communication. Ethically, this approach prioritizes material resources over the human coordination necessary to deploy them effectively, potentially leading to misallocation or spoilage. Another incorrect approach prioritizes the development of detailed evacuation routes. Evacuation is a critical function, but it is a subset of the overall response. Regulatory failures arise if the plan focuses on how to evacuate without ensuring the organization can communicate the need to evacuate, coordinate with external agencies, or manage the patient flow during such an event. Ethically, this approach might lead to premature or uncoordinated evacuations, endangering vulnerable patients. A third incorrect approach centers on establishing a comprehensive patient tracking system. Patient tracking is vital for accountability and care continuity. However, the regulatory failure here is that, without effective communication, the data generated by such a system cannot be shared with relevant personnel or agencies, rendering it isolated and less impactful. Ethically, while patient tracking is important, its effectiveness is contingent on the broader communication infrastructure that allows for its integration into the overall response. Professional reasoning. Professionals should approach this by first understanding the foundational requirements of disaster preparedness as outlined by the National Healthcare Disaster Certification. The decision-making process should involve a hierarchical assessment of plan components, starting with those that enable all other functions. This means asking, what is the absolute first thing that must work for any other part of the plan to be executed? This often leads to identifying communication as the primary enabler. Professionals should then consider how each component supports patient safety, operational continuity, and regulatory compliance. When faced with prioritization decisions, they should consult relevant standards and guidelines, engage in tabletop exercises to test plan components, and seek input from diverse stakeholders to ensure a holistic and robust plan. Question 7. Process analysis reveals that during a widespread public health emergency, a healthcare facility's ability to access critical resources and receive timely guidance is heavily dependent on its preparedness for interagency collaboration. Which of the following actions best exemplifies a proactive and compliant approach to coordinating with local, state, and federal agencies for disaster response? Option A. Establishing and regularly updating formal memoranda of understanding, MOU, with local, state, and federal emergency management agencies, and participating in joint disaster drills with these entities. Option B. Focusing solely on building strong relationships with local hospitals and emergency medical services, assuming state and federal support will be automatically provided. Option C. Waiting for a disaster to occur and then initiating contact with local emergency management officials to request assistance and information. Option D. Developing internal communication protocols for the facility and only engaging with external agencies if specifically contacted by them. The correct answer is A. Establishing and regularly updating formal memoranda of understanding MOU with local, state, and federal emergency management agencies, and participating in joint disaster drills with these entities. Explanation. This scenario is professionally challenging because effective disaster response hinges on seamless collaboration between healthcare entities and a multitude of governmental agencies at various levels. The complexity arises from differing mandates, communication protocols, resource availability, and command structures inherent in local, state, and federal systems. Misunderstandings or a lack of established relationships can lead to critical delays in resource allocation, information sharing, and coordinated patient movement, directly impacting patient outcomes and the overall effectiveness of the disaster response. Careful judgment is required to navigate these interagency dynamics, ensuring that the healthcare organization's needs are met while respecting the established frameworks of public emergency management. The correct approach represents best professional practice because it prioritizes the establishment and maintenance of pre-existing, documented communication channels and collaborative agreements with all relevant local, state, and federal agencies. This proactive strategy, often formalized through memoranda of understanding MOU or similar interagency agreements, ensures that during a disaster, there is a clear understanding of roles, responsibilities, reporting structures, and points of contact. This aligns with the principles of the National Response Framework, NRF, and the National Incident Management System, NIMS, which emphasize a unified command structure and coordinated efforts across all levels of government and non-governmental partners. Such preparedness allows for rapid information exchange, efficient resource requests, and synchronized deployment of assets, thereby optimizing the healthcare system's ability to respond to and recover from a disaster. An incorrect approach that relies solely on ad hoc communication during an event fails to meet regulatory expectations for preparedness. This approach creates significant ethical and regulatory failures by introducing uncertainty and potential for miscommunication at a critical juncture. It violates the spirit of preparedness mandated by federal guidelines that expect healthcare organizations to be integrated into broader emergency response plans. Another incorrect approach that focuses exclusively on local agencies, neglecting state and federal coordination, is also professionally unacceptable. This creates a significant gap in the response capability, as state and federal agencies often possess resources, expertise, and authority that are crucial for large-scale disasters, such as access to strategic national stockpiles or the ability to coordinate multi-state mutual aid. Failure to engage these higher levels of government can lead to an inability to access essential support, thus compromising patient care and public safety. Professionals should employ a decision-making framework that begins with a thorough understanding of the National Response Framework, NRF, and the National Incident Management System, NIMS. This involves proactively identifying all relevant local, state, and federal agencies that have a role in disaster response and healthcare support. The next step is to actively engage these agencies through established channels, participating in joint training exercises, and developing formal agreements that outline mutual support and communication protocols. During a disaster, the framework dictates adherence to these pre-established plans, prioritizing clear, concise, and timely communication through designated points of contact, and understanding the chain of command and reporting requirements for each agency involved. Continuous evaluation and refinement of these relationships and plans are essential for ongoing preparedness. Question 8. Consider a scenario where a regional healthcare system is conducting a comprehensive assessment of its vulnerabilities to potential disasters. Which of the following approaches would best align with the principles of robust disaster preparedness and the requirements for national healthcare disaster certification in the United States? Option A. Conducting a detailed analysis of the system's capacity to manage patient surge during a large-scale infectious disease outbreak, including evaluating surge capacity plans, staffing models, and the availability of critical medical equipment and supplies, while also assessing the resilience of communication networks and supply chain logistics for essential pharmaceuticals and medical devices. Option B. Focusing the assessment primarily on the immediate financial impact of various disaster scenarios, prioritizing preparedness measures that offer the quickest return on investment in terms of cost savings. Option C. Limiting the vulnerability assessment to only those disaster scenarios that have occurred in the region within the last decade, assuming that past events are the sole indicators of future risks. Option D. Relying exclusively on the recommendations of a single external consultant, without engaging internal stakeholders or cross-referencing findings with established federal guidelines for healthcare preparedness. Correct answer is A. Conducting a detailed analysis of the system's capacity to manage patient surge during a large-scale infectious disease outbreak, including evaluating surge capacity plans, staffing models, and the availability of critical medical equipment and supplies, while also assessing the resilience of communication networks and supply chain logistics for essential pharmaceuticals and medical devices. Explanation: this scenario is professionally challenging because assessing healthcare system vulnerabilities requires a nuanced understanding of interconnected systems, potential cascading failures, and the specific regulatory landscape governing disaster preparedness in the United States. A comprehensive vulnerability assessment must go beyond identifying single points of failure and consider how various components of the healthcare system interact and could be compromised during a disaster. Careful judgment is required to prioritize risks, allocate resources effectively, and ensure compliance with federal and state mandates for emergency preparedness. The correct approach represents best professional practice because it aligns with the core principles of the National Healthcare Disaster Certification, which emphasizes a systematic, evidence-based, and multifaceted evaluation of preparedness. This approach involves a thorough review of existing plans, infrastructure, supply chains, and human resources, considering a wide range of potential hazards. It also necessitates engagement with all relevant stakeholders, including local, state, and federal agencies, as well as community partners, to ensure a coordinated and effective response. This comprehensive methodology directly supports the regulatory requirement to develop robust and adaptable disaster preparedness plans that can withstand diverse threats. An incorrect approach that focuses solely on immediate resource availability, such as stockpiling personal protective equipment, PPE, fails to address the broader systemic vulnerabilities. While PPE is critical, a lack of functional communication systems, inadequate staff training, or a compromised supply chain for essential medications would render even ample PPE insufficient. This approach neglects the interconnectedness of disaster response and overlooks critical operational and logistical challenges, potentially leading to a false sense of security. Ethically, it fails to uphold the duty of care to patients by not addressing all significant risks. Another incorrect approach that prioritizes only the most probable disaster scenario, such as a localized natural disaster, is also professionally unacceptable. While probability is a factor, a comprehensive vulnerability assessment must also consider the impact of less probable but high-consequence events, such as a widespread pandemic or a cyber attack on critical infrastructure. Focusing narrowly on the most likely event can leave the healthcare system critically exposed to other significant threats, violating the principle of comprehensive preparedness mandated by disaster certification standards. This oversight can lead to catastrophic failures when unexpected events occur. A third incorrect approach that relies solely on historical data without considering emerging threats or technological advancements is also flawed. While past events offer valuable lessons, the nature of disasters and healthcare system vulnerabilities evolves. Failing to incorporate current threat assessments, advancements in medical technology, or changes in population demographics can lead to outdated and ineffective preparedness strategies. This static approach fails to meet the dynamic requirements of disaster preparedness and can result in a system that is ill-equipped to handle novel challenges. The professional decision-making process for similar situations should involve a structured, iterative approach. Professionals should begin by defining the scope of the assessment, identifying all relevant hazards, natural, technological, biological, etc., and then systematically evaluating the healthcare system's capacity to prevent, protect against, respond to, and recover from each hazard. This involves analyzing infrastructure, personnel, supplies, communication, command and control, and external dependencies. Crucially, the process must be collaborative, involving diverse stakeholders, and should be informed by regulatory requirements, best practices, and continuous learning from exercises and real-world events. Question 9. The investigation demonstrates that a healthcare facility's disaster preparedness plan, while comprehensive in its initial scope, has not been systematically reviewed or updated in over 5 years, leading to outdated communication protocols and a lack of integration with new electronic health record systems. This oversight has created significant vulnerabilities in the facility's ability to coordinate effectively during a large-scale public health emergency. Which of the following actions best addresses this systemic failure in disaster preparedness policy integration? Option A. Conduct a one-time training session for all staff on the existing disaster preparedness plan to refresh their knowledge of current protocols. Option B. Allocate additional resources to the emergency department to enhance immediate response capabilities during a crisis without altering existing policies. Option C. Initiate a comprehensive review and revision of all relevant healthcare policies to embed disaster preparedness principles, ensuring alignment with current operational capabilities and emerging threats, and establishing a regular review cycle. Option D. Form a temporary committee to draft a supplementary document outlining how new electronic health record systems could be used in disaster scenarios. The correct answer is C. Initiate a comprehensive review and revision of all relevant healthcare policies to embed disaster preparedness principles, ensuring alignment with current operational capabilities and emerging threats, and establishing a regular review cycle. Explanation. Scenario analysis. This scenario presents a professional challenge rooted in the tension between immediate operational needs and the long-term strategic imperative of integrating disaster preparedness into core healthcare policies. The difficulty lies in balancing resource allocation, competing priorities, and the potential for perceived disruption to routine services versus the critical need for robust disaster readiness. The ethical dimension arises from the responsibility to protect patient safety and community well-being, which necessitates proactive planning for catastrophic events, even when those events are not imminent. Careful judgment is required to ensure that preparedness efforts are not merely an add-on, but are woven into the fabric of the organization's operational and strategic planning. Correct approach analysis. The correct approach, which involves a systematic review and revision of existing healthcare policies to embed disaster preparedness principles, represents best professional practice because it aligns with the fundamental principles of healthcare governance and risk management. This approach ensures that disaster preparedness is not an isolated initiative, but a continuous process integrated into the organization's culture and operations. It is ethically sound as it prioritizes patient safety and community resilience by establishing a framework for response and recovery that is sustainable and adaptable. Regulatory frameworks, such as those governing healthcare accreditation and emergency preparedness e.g., HIPAA security rules emphasis on contingency planning, CMS emergency preparedness requirements, mandate such integration. This approach fosters accountability, ensures consistent application of preparedness measures, and facilitates ongoing evaluation and improvement, thereby meeting legal and ethical obligations. Incorrect approaches analysis. One incorrect approach might involve treating disaster preparedness as a standalone project with a defined end date. This is professionally unacceptable because it fails to recognize that disaster threats are dynamic and require ongoing attention and adaptation. It creates a false sense of security once the project is completed and neglects the need for regular drills, training updates, and policy revisions in response to evolving threats or lessons learned from other events. This approach violates the ethical duty to maintain a state of readiness and may fall short of regulatory requirements for continuous improvement in emergency preparedness. Another incorrect approach could be to delegate disaster preparedness solely to a single department or individual without broader organizational buy-in or policy integration. This is professionally unsound as it limits the scope of preparedness and can lead to fragmented efforts and a lack of coordination during an actual event. It fails to leverage the collective expertise and resources of the entire healthcare organization. Ethically, it diffuses responsibility and may result in critical gaps in preparedness that could jeopardize patient care and staff safety. Regulatory compliance is also compromised as comprehensive preparedness requires a multidisciplinary, organization-wide commitment. A third incorrect approach might be to prioritize immediate patient care needs to the exclusion of all preparedness activities, assuming that resources are too scarce to allocate to planning. While patient care is paramount, this approach represents a failure of foresight and risk management. It is ethically problematic, as it neglects the organization's responsibility to prepare for events that could overwhelm its capacity to provide care. This reactive stance is not only less effective, but also more costly in the long run. It directly contravenes regulatory expectations for healthcare facilities to maintain robust emergency preparedness plans, which are designed to ensure continuity of care during crises. Professional reasoning. Professionals should adopt a decision-making process that begins with a comprehensive risk assessment to identify potential disaster scenarios relevant to their specific healthcare setting and geographic location. This assessment should inform the development of a strategic plan for disaster preparedness that is integrated into the organization's overall mission, vision, and operational framework. Key stakeholders, including leadership, clinical staff, administrative personnel, and relevant external agencies, must be involved in policy development and implementation. Regular training, drills, and exercises are essential to test and refine plans. A continuous improvement cycle, incorporating lessons learned from exercises, real-world events, and evolving best practices, should be established. This systematic and integrated approach ensures that disaster preparedness is a living, evolving component of the organization's commitment to patient safety and community well-being, thereby meeting both ethical obligations and regulatory requirements. Question 10. Upon reviewing the preparedness plan for a large urban hospital, which of the following methodologies for identifying potential hazards and vulnerabilities best aligns with the core principles and regulatory framework of the National Healthcare Disaster Certification? Option A. Delegating the entire hazard identification process to external consultants without involving internal subject matter experts from various hospital departments. Option B. Conducting a comprehensive hazard vulnerability analysis, HVA, that systematically evaluates potential natural, technological, and human-caused disasters, considering their likelihood, impact on critical infrastructure and patient populations, and the facility's specific vulnerabilities. Option C. Relying exclusively on a review of past disaster events that have impacted the local region to predict future threats. Option D. Focusing the assessment solely on the most commonly discussed natural disasters, such as hurricanes and earthquakes, as these are the most probable. The correct answer is B. Conducting a comprehensive hazard vulnerability analysis, HVA, that systematically evaluates potential natural, technological, and human-caused disasters, considering their likelihood, impact on critical infrastructure and patient populations, and the facility's specific vulnerabilities. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a healthcare facility to proactively identify potential threats to its operations and patient safety during a disaster, moving beyond reactive measures. The complexity lies in anticipating a wide range of hazards, from natural events to technological failures and human-caused incidents, and then assessing how these could impact critical healthcare functions and vulnerable patient populations. This demands a comprehensive understanding of the facility's infrastructure, services, and the specific risks prevalent in its geographic and operational context, all while adhering to stringent regulatory mandates. Correct approach analysis. The correct approach involves a systematic and multifaceted hazard identification and vulnerability assessment process, directly aligned with the National Healthcare Disaster Certification requirements. This process mandates a thorough review of potential internal and external threats, considering their likelihood and potential impact on patient care, staff safety, and facility integrity. It requires engaging diverse stakeholders, including clinical staff, facilities management, and emergency preparedness coordinators, to gain a holistic perspective. The outcome is a prioritized list of risks that informs the development of robust mitigation and response strategies, ensuring compliance with regulatory expectations for preparedness and resilience. This approach embodies best professional practice by prioritizing patient safety and operational continuity through proactive risk management. Incorrect approaches analysis, focusing solely on historical disaster data without considering emerging threats or unique facility vulnerabilities, represents a failure to conduct a comprehensive assessment as required by the certification. This approach is limited and may overlook novel risks or specific weaknesses within the facility. Limiting the assessment to only natural disasters neglects other significant categories of hazard, such as technological failures, e.g., power outages, IT system failures, or human-caused events, e.g., active shooter incidents, supply chain disruptions, which are explicitly within the scope of disaster preparedness. Prioritizing only the most visible or frequently discussed hazards without a structured methodology to identify less obvious but potentially catastrophic vulnerabilities demonstrates a lack of due diligence. This can lead to critical gaps in preparedness, leaving the facility exposed to unforeseen risks. Professional reasoning. Professionals should adopt a structured, evidence-based approach to hazard identification and vulnerability assessment. This involves 1. Establishing a clear scope and objectives for the assessment, aligned with regulatory requirements. 2. Employing a variety of methodologies, including historical data review, expert consultation, site surveys, and scenario planning. 3. Engaging a multidisciplinary team to ensure all potential hazards and vulnerabilities are considered from various perspectives. 4. Documenting the assessment process, findings, and recommendations thoroughly. 5. Regularly reviewing and updating the assessment to account for changes in the threat landscape, facility operation, and regulatory guidance. This systematic process ensures that preparedness efforts are targeted, effective, and compliant with the National Healthcare Disaster Certification standards. Question 11. The audit findings indicate a deficiency in the organization's proactive identification and evaluation of potential healthcare disaster scenarios and their associated impacts. Which of the following approaches best addresses this finding in accordance with established disaster preparedness principles? Option A. Initiate a comprehensive, documented process to identify potential healthcare disaster hazards, analyze their likelihood and impact, and evaluate the resulting risks to the organization and its patients. Option B. Contract with an external risk management firm to conduct a complete disaster risk assessment and provide recommendations without internal involvement in the assessment process. Option C. Focus on revising existing emergency response protocols and procedures to reflect current best practices. Option D. Immediately procure a broad range of general emergency supplies and equipment to enhance overall readiness. The correct answer is A. Initiate a comprehensive, documented process to identify potential healthcare disaster hazards, analyze their likelihood and impact, and evaluate the resulting risks to the organization and its patients. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing immediate operational needs with long-term preparedness and compliance. The audit findings highlight a potential gap in the organization's ability to proactively identify and mitigate healthcare disaster risks, which can have severe consequences for patient safety, operational continuity, and regulatory standing. Effective risk assessment is foundational to a robust disaster preparedness plan, and a failure in this area can cascade into other critical functions. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the audit findings by initiating a comprehensive, systematic, and documented process for identifying, analyzing, and evaluating potential healthcare disaster risks. This aligns with the core principles of disaster preparedness and risk management mandated by regulatory frameworks such as those outlined by the National Healthcare Disaster Certification. A structured approach ensures that all relevant hazards are considered, their potential impact is understood, and appropriate mitigation strategies can be developed. This proactive stance is crucial for demonstrating due diligence and ensuring the organization's resilience in the face of emergencies. Incorrect approaches analysis. An approach that focuses solely on updating existing emergency response protocols without a preceding risk assessment fails to address the root cause identified by the audit. This is a regulatory failure because it bypasses the fundamental requirement to understand the specific threats and vulnerabilities before developing or revising response plans. Ethically, it is a failure to adequately protect patients and staff by not proactively identifying potential harms. An approach that prioritizes immediate resource acquisition for general emergency supplies without a risk-informed basis is also problematic. This represents a regulatory failure as it deviates from a systematic, evidence-based approach to resource allocation, which is often a component of disaster preparedness standards. Ethically, it can lead to inefficient use of resources and may not address the most critical vulnerabilities, potentially leaving the organization unprepared for specific, high-impact scenarios. An approach that delegates the entire risk assessment process to external consultants without internal oversight or integration into the organization's strategic planning is a significant professional and regulatory failure. While consultants can provide expertise, the ultimate responsibility for understanding and managing risks lies with the organization's leadership. This approach fails to foster internal capacity and ownership, potentially leading to a disconnect between the assessment and the organization's operational reality, and may not fully comply with requirements for internal governance and accountability in disaster preparedness. Professional reasoning. Professionals should approach this situation by first acknowledging the audit findings as a critical signal for improvement. The decision-making process should involve 1. Understanding the specific regulatory requirements for risk assessment within the National Healthcare Disaster Certification Framework. 2. Establishing a cross-functional team to conduct the risk assessment, ensuring diverse perspectives. 3. Employing a standardized methodology for hazard identification, vulnerability analysis, and risk evaluation. 4. Documenting the entire process and its outcomes thoroughly. 5. Integrating the findings into the organization's overall disaster preparedness and response strategy, including resource allocation and training. This systematic and integrated approach ensures compliance, enhances resilience, and upholds ethical obligations to protect the community. Question 12. Examination of the data shows a novel, highly transmissible communicable disease has been identified among attendees at a large, multi-day outdoor music festival. Public health officials have been notified, and initial reports indicate a significant number of symptomatic individuals and potential exposures. Given the scale of the event and the characteristics of the pathogen, what is the most appropriate immediate management strategy for the healthcare and public health stakeholders involved? Option A. Implement a coordinated, multi-agency response involving public health authorities, event organizers, and healthcare providers to activate emergency plans, initiate contact tracing, and provide guidance on isolation and quarantine measures for exposed individuals, while ensuring transparent public communication. Option B. Instruct event security to identify and isolate any attendee exhibiting visible symptoms within a designated area of the venue, while withholding detailed information from the general public to prevent widespread alarm. Option C. Advise event organizers to immediately close all medical tents and instruct attendees to self-isolate at their accommodations, without further engagement from public health agencies until the event concludes. Option D. Focus solely on treating symptomatic individuals within the festival's existing medical facilities, and advise attendees to report any future symptoms to their personal physicians after leaving the event. The correct answer is A. Implement a coordinated, multi-agency response involving public health authorities, event organizers, and healthcare providers to activate emergency plans, initiate contact tracing, and provide guidance on isolation and quarantine measures for exposed individuals, while ensuring transparent public communication. Explanation: scenario analysis. This scenario presents a significant professional challenge due to the rapid and unpredictable nature of a novel communicable disease outbreak during a large public event. The healthcare system faces immediate strain, requiring swift and decisive action to protect both the attendees and the wider community. Balancing public health imperatives with individual rights, resource limitations, and the need for clear, consistent communication under pressure is paramount. The lack of established protocols for this specific novel pathogen adds a layer of complexity, demanding adaptability and reliance on foundational public health principles. Correct approach analysis. The correct approach emphasizes a multi-agency, coordinated response guided by established public health principles and regulatory frameworks for infectious disease control. This involves immediate notification of public health authorities, activation of emergency response plans, and the establishment of a unified command structure. The focus on evidence-based public health interventions, such as contact tracing, isolation, quarantine, and public education, directly aligns with the National Healthcare Disaster Certification's emphasis on preparedness and response to public health emergencies. This approach prioritizes the containment of the disease, mitigation of its spread, and the protection of vulnerable populations, all while adhering to ethical considerations of public welfare and informed consent where applicable. Regulatory compliance is achieved by following established guidelines for disease surveillance, reporting, and outbreak management, as mandated by federal and state public health laws. Incorrect approaches analysis. One incorrect approach involves a reactive, uncoordinated response solely managed by the event organizers without engaging public health agencies. This fails to leverage the expertise and resources of trained public health professionals, potentially leading to inadequate containment measures, delayed reporting, and a lack of standardized protocols. Ethically, this approach neglects the broader public health responsibility beyond the event's immediate attendees. Regulatory failures include noncompliance with mandatory disease reporting laws and emergency preparedness mandates. Another incorrect approach focuses exclusively on isolating symptomatic individuals within the event venue without comprehensive contact tracing or broader public health interventions. This is insufficient for controlling a novel communicable disease, as asymptomatic or pre-symptomatic transmission is a significant risk. It also places an undue burden on the event organizers and may infringe upon the rights of individuals without confirmed illness. Regulatory and ethical failures include a lack of adherence to established quarantine and isolation guidelines, and a failure to protect the wider community from potential exposure. A third incorrect approach involves withholding information from the public and health authorities to avoid panic or negative publicity. This is a critical ethical and regulatory failure. Transparency and timely communication are essential for effective public health response, enabling individuals to take necessary precautions and allowing authorities to implement appropriate control measures. Secrecy undermines public trust and can exacerbate the outbreak by hindering collaborative efforts. Regulatory frameworks mandate reporting of certain communicable diseases, and failure to do so carries legal consequences. Professional reasoning. Professionals facing such a scenario should employ a structured decision-making process. First, immediately activate the established emergency operations plan and notify relevant public health authorities. Second, establish a unified command structure to ensure coordinated efforts among all stakeholders. Third, gather and assess available data on the disease, its transmission, and potential impact. Fourth, implement evidence-based public health interventions, prioritizing containment and mitigation. Fifth, ensure clear, consistent, and transparent communication with the public, healthcare providers, and other stakeholders. Finally, continuously evaluate the situation and adapt the response as new information becomes available, always adhering to ethical principles and regulatory requirements. Question 13. Performance analysis shows that during a recent large-scale disaster, a healthcare facility struggled with information dissemination. Which of the following communication strategies best aligns with regulatory frameworks and best practices for emergency management in the United States? Option A. Establishing a centralized command for all internal and external communications, designating specific spokesperson, and utilizing pre-approved communication channels, including official press releases and facility-wide alerts, to ensure consistent and verified information flow. Option B. Prioritizing internal staff communication and deferring all external communication to a later time once the immediate crisis has subsided, to avoid overwhelming the communication systems. Option C. Relying primarily on informal word-of-mouth communication among staff and encouraging patients to seek information from external news sources to manage internal communication load. Option D. Allowing individual departments to independently communicate updates to their respective staff and the public via their preferred social media platforms to ensure rapid dissemination of information. The correct answer is A. Establishing a centralized command for all internal and external communications, designating specific spokespersons, and utilizing pre-approved communication channels, including official press releases and facility-wide alerts, to ensure consistent and verified information flow. Explanation. Scenario analysis. This scenario is professionally challenging because during a mass casualty incident, healthcare facilities face immense pressure to disseminate accurate and timely information to a diverse range of stakeholders, including patients, families, staff, and external agencies, while simultaneously managing overwhelming operational demands. The rapid evolution of the situation and the potential for misinformation necessitate a structured and compliant communication strategy. Correct approach analysis. The correct approach prioritizes establishing a centralized command structure for all communications, ensuring that information is vetted, consistent, and disseminated through pre-approved channels. This aligns with the principles of Incident Command Systems, ICS, and Emergency Preparedness Guidelines, which emphasize clear lines of authority and communication flow to prevent confusion and maintain situational awareness. Adhering to established protocols for public information dissemination, such as those outlined by the Department of Health and Human Services, HHS, and relevant state emergency management agencies, is crucial for regulatory compliance and effective crisis management. This approach ensures that all communications are accurate, timely, and reach the intended audiences through appropriate means, thereby minimizing panic and facilitating coordinated response efforts. Incorrect approach is analysis. Failing to establish a centralized communication point and allowing individual departments to communicate independently leads to fragmented and potentially contradictory information. This violates principles of ICS and can cause significant confusion among staff and the public, undermining the coordinated response. It also increases the risk of disseminating unverified or inaccurate information, which can have serious ethical and legal ramifications. Relying solely on social media platforms without a clear verification process or designated spokespersons is a significant regulatory and ethical failure. While social media can be a tool, it is not a primary or sole source for official emergency communications. Unverified information can spread rapidly, leading to public distress and distrust. Furthermore, it bypasses established protocols for official public information dissemination, potentially violating guidelines from agencies like FEMA or state public health departments. Limiting communication to internal staff without a plan to inform patients and their families about the situation, facility status, and care continuity is ethically problematic and can lead to significant distress and anxiety for those affected. It also fails to meet the expectations of transparency and accountability required during emergencies, potentially leading to complaints and a breakdown in trust. Professional reasoning. Professionals should employ a decision-making framework that begins with activating the facility's Emergency Operations Plan, EOP. This plan should detail communication protocols, including the establishment of a Joint Information Center, JIC, or a designated Public Information Officer, PO, responsible for all external communications. Internal communication channels should also be clearly defined. The process involves 1. Assessing the information needs of all stakeholders. 2. Developing clear, concise, and accurate messages. 3. Disseminating messages through pre-identified and approved channels. 4. continuously monitoring and updating information as the situation evolves. 5. Ensuring all communications are consistent with regulatory requirements and ethical obligations for transparency and patient welfare. Question 14. Benchmark analysis indicates that during a widespread infectious disease outbreak overwhelming local hospitals, a critical shortage of nurses arises. To optimize the allocation of human resources for patient care, which of the following strategies best aligns with established healthcare disaster preparedness principles and ethical obligations? Option A. Maintaining strict adherence to pre-disaster departmental assignments, ensuring each unit operates with its designated staff, regardless of patient load or acuity in other units. Option B. Reassigning nurses from less critical departments, such as elective surgery recovery, to the intensive care unit, while temporarily cross-training available ancillary staff to support basic patient needs in less acute areas. Option C. Withholding a portion of the nursing staff to manage administrative tasks and documentation, even if it means fewer nurses are available for direct patient care on the wards. Option D. Prioritizing the deployment of nurses based on their years of service within the hospital system, ensuring that more experienced staff are assigned to the most critical roles. The correct answer is B. Reassigning nurses from less critical departments, such as elective surgery recovery, to the intensive care unit, while temporarily cross-training available ancillary staff to support basic patient needs in less acute areas. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing immediate life-saving needs with the long-term sustainability of healthcare operations during a catastrophic event. The scarcity of human resources, coupled with the unpredictable nature of a disaster, necessitates rapid, ethical, and legally compliant decision-making. The pressure to act quickly can lead to suboptimal choices if not guided by established protocols and ethical principles. The inherent stress and potential for loss of life amplify the need for a structured and justifiable approach to resource allocation. Correct approach analysis. The correct approach prioritizes the most critical patient needs and leverages existing staff expertise in a flexible manner, aligning with the principles of emergency management and healthcare disaster preparedness. This involves a systematic assessment of patient acuity and matching it with available personnel who possess the necessary skills, even if it means cross-training or reassigning roles temporarily. This strategy maximizes the impact of limited human resources by ensuring that those with the highest skill levels are deployed where they can provide the most life-saving care, while also maintaining essential services. This aligns with the National Healthcare Disaster Certification's emphasis on adaptable and resilient healthcare systems during emergencies, which implicitly requires efficient and ethical human resource deployment. The focus is on achieving the greatest good for the greatest number of patients under extreme duress, a core tenet of disaster ethics and operational readiness. Incorrect approaches analysis. One incorrect approach involves solely relying on pre-assigned roles without considering the evolving needs of the disaster. This rigidity can lead to skilled personnel being underutilized in areas where their expertise is less critical, while other areas are critically understaffed. This fails to optimize resource allocation and can result in preventable patient harm, violating the ethical obligation to provide the best possible care under the circumstances. It also ignores the dynamic nature of disaster response, which requires flexibility. Another incorrect approach is to prioritize staff based on seniority or personal relationships rather than clinical need and skill. This is ethically indefensible and can lead to unqualified individuals making critical decisions or performing tasks beyond their competence, directly endangering patients. Such an approach undermines the principles of fairness and meritocracy essential in emergency response and is contrary to the professional standards expected in healthcare disaster management. A third incorrect approach is to withhold staff from critical patient care areas to maintain administrative functions that are not immediately essential for life-saving interventions. While some administrative oversight is necessary, the primary focus during a disaster must be on direct patient care. Failing to deploy available clinical staff to the front lines when patients are in critical need represents a significant ethical and professional failure, potentially leading to avoidable deaths and contravening the core mission of healthcare. Professional reasoning. Professionals should employ a decision-making framework that begins with a rapid assessment of the disaster's impact and the immediate needs of the patient population. This assessment should then be cross-referenced with the available human resources, considering their skills, certifications, and current physical and mental capacity. The next step involves prioritizing tasks based on their criticality for saving lives and stabilizing the situation. This leads to the strategic deployment of personnel, utilizing a surge capacity model where staff are cross-trained or reassigned to areas of greatest need. Continuous reassessment and adaptation of the deployment plan are crucial as the situation evolves. This process should be guided by established disaster response plans, ethical principles of beneficence and justice, and regulatory requirements for healthcare disaster preparedness. Question 15. Analysis of a novel infectious disease outbreak occurring in the immediate aftermath of a Category 5 hurricane, which has severely damaged critical infrastructure and displaced a significant portion of the population, requires a robust strategy for monitoring health impacts. Considering the limited resources and the urgency of the situation, which of the following surveillance and monitoring approaches would be most effective in guiding immediate public health interventions and resource allocation? Option A. Focus solely on laboratory confirmation of suspected cases reported by the few remaining operational healthcare facilities, as this provides the most definitive data on the pathogen. Option B. Establish a comprehensive syndromic surveillance system that integrates data from emergency departments, primary care clinics, and mobile health units, coupled with active case finding in shelters and affected communities, and prioritize laboratory confirmation of suspected cases. Option C. Implement a passive surveillance system where healthcare providers voluntarily report any unusual health trends they observe, without active outreach or systematic data collection. Option D. Prioritize the development of a long-term epidemiological research study to understand the chronic health effects of the outbreak, deferring immediate surveillance needs until infrastructure is restored. The correct answer is B. Establish a comprehensive syndromic surveillance system that integrates data from emergency departments, primary care clinics, and mobile health units, coupled with active case finding in shelters and affected communities, and prioritize laboratory confirmation of suspected cases. Explanation. Scenario analysis. This scenario presents a significant challenge due to the rapid onset of a novel infectious disease outbreak following a major natural disaster. The dual nature of the crisis, a disaster compounding a public health emergency, strains already limited resources and necessitates immediate, coordinated action. The lack of pre-existing data on the specific pathogen and its transmission patterns in this disaster-affected population adds a layer of uncertainty, making timely and accurate surveillance critical for effective response and resource allocation. The need to balance immediate life-saving interventions with the long-term goal of understanding and mitigating the health impacts of the outbreak under chaotic conditions requires careful judgment. Correct approach analysis. The most effective approach involves establishing a multi-pronged surveillance system that integrates real-time data from various sources. This includes leveraging existing public health infrastructure, such as emergency departments and primary care clinics. Report syndromic data, e.g., fever, respiratory distress. Simultaneously, it requires active case finding in affected communities, particularly in shelters and displaced populations, to identify confirmed cases and their contacts. Laboratory confirmation of suspected cases is paramount for understanding the pathogen. Data analysis should focus on identifying trends, geographic hotspots, and demographic vulnerabilities. This approach aligns with the principles of public health surveillance, which emphasize timeliness, completeness, and representativeness, as outlined in national public health guidelines for disaster response. It allows for rapid identification of emerging threats, informs public health interventions, e.g., vaccination campaigns, isolation protocols, and guides resource deployment to areas of greatest need, thereby fulfilling the ethical obligation to protect public health. Incorrect approaches analysis. Relying solely on passive reporting from healthcare facilities without active case finding would be a significant regulatory and ethical failure. This approach would likely lead to undercounting cases, especially among vulnerable populations with limited access to healthcare, delaying the recognition of the outbreak's true scope and severity. Fails to meet the completeness and representativeness standards of effective surveillance. Focusing exclusively on laboratory confirmation without syndromic surveillance or active case finding would also be problematic. While laboratory data is crucial for definitive diagnosis, it is often delayed and may not capture the initial spread of the disease. This would hinder early detection and intervention, potentially allowing the outbreak to escalate unchecked, violating the principle of proactive public health protection. Implementing a surveillance system that prioritizes data collection for long-term research without immediate actionable insights for the current crisis would be a critical failure. While research is valuable, the immediate priority during an active disaster and outbreak is to save lives and control the spread. This approach would neglect the urgent need for timely information to guide immediate public health actions, representing a dereliction of duty to the affected population. Professional reasoning. Professionals should adopt a tiered and integrated approach to surveillance. This involves first understanding the immediate information needs for response, e.g., case numbers, severity, geographic distribution. Then, they should assess available resources and existing infrastructure to determine the most feasible data collection methods. The decision-making process should prioritize rapid data acquisition and analysis that can directly inform interventions, while also laying the groundwork for more comprehensive epidemiological investigation. This requires constant communication between public health officials, healthcare providers, and emergency management agencies to ensure that surveillance efforts are aligned with the evolving needs of the disaster response. Ethical considerations, such as data privacy and equitable access to surveillance and subsequent interventions, must be integrated throughout the process. Question 16. Compliance review shows that a major metropolitan area experienced a significant public health emergency requiring a coordinated healthcare disaster response. A key challenge identified was the optimal integration of various non-governmental organizations, (NGO), that offered critical support, ranging from volunteer medical personnel to mobile health clinics and community outreach services. Which of the following approaches best reflects the appropriate role and integration of NGOs in a U.S.-based healthcare disaster response, adhering to established frameworks and best practices? Option A. The primary role of NGOs in a healthcare disaster response is to provide supplementary services that fill identified gaps in governmental capacity, operating under collaborative agreements that respect their organizational mandates and expertise while aligning with overall response objectives. Option B. Governmental agencies should prioritize utilizing their own resources exclusively, only engaging NGOs as a last resort when all internal capabilities have been exhausted, to maintain strict governmental control over the response. Option C. NGOs should be fully integrated into the governmental incident command structure, with their personnel and resources directly managed and directed by federal, state, or local public health officials to ensure unified control and accountability. Option D. NGOs should be treated as independent entities, with governmental agencies only engaging them on a case-by-case basis for specific, predefined tasks, without fostering broader collaborative planning or information sharing. The correct answer is C. NGOs should be fully integrated into the governmental incident command structure, with their personnel and resources directly managed and directed by federal, state, or local public health officials to ensure unified control and accountability. Explanation. Scenario analysis. This scenario is professionally challenging because it requires healthcare disaster managers to navigate the complex interplay between governmental agencies and non-governmental organizations, (NGO), during a crisis. The effective integration of NGO resources, while respecting their distinct mandates and operational capacities, is crucial for a comprehensive and efficient disaster response. Misunderstanding or misapplying the roles of NGOs can lead to duplication of efforts, resource waste, or critical gaps in service delivery, all of which can negatively impact patient outcomes and community well-being. Correct approach analysis. The correct approach emphasizes understanding and leveraging the specific expertise and resources that NGOs bring to disaster response, aligning their efforts with the overall incident command structure and governmental objectives. This aligns with the principles of coordinated disaster response, where different entities contribute their unique strengths. In the context of U.S. healthcare disaster preparedness and response, this often involves recognizing NGOs as vital partners who can provide specialized services, logistical support, or community outreach that complement governmental capabilities. This approach respects the autonomy of NGOs while ensuring their contributions are integrated into a unified response, maximizing effectiveness and minimizing conflict. Incorrect approaches analysis. One incorrect approach fails to acknowledge the distinct operational frameworks and reporting structures of NGOs, attempting to directly command their personnel and resources as if they were part of a government agency. This violates principles of interorganizational cooperation and can lead to friction, resistance, and ultimately, a less effective response. Ethically, it disrespects the organizational integrity and volunteer nature of many NGOs. Another incorrect approach overlooks the potential for NGOs to fill critical gaps in healthcare delivery or public health support that governmental agencies may not be able to address immediately or comprehensively. By solely relying on governmental resources, this approach misses opportunities to enhance the overall capacity and reach of the disaster response, potentially leaving vulnerable populations underserved. This can be seen as a failure to optimize resource utilization, a key tenet of disaster management. A third incorrect approach involves treating NGOs as mere vendors or contractors, focusing solely on transactional relationships without fostering collaborative partnerships. This limits the potential for proactive planning, information sharing, and mutual support, which are essential for building resilient healthcare disaster response systems, fails to recognize the intrinsic value and often mission-driven nature of NGO contributions. Professional reasoning. Professionals should employ a decision-making framework that prioritizes understanding the landscape of available resources, both governmental and non-governmental. This involves proactive engagement with potential NGO partners during preparedness phases, clearly defining roles, responsibilities, and communication channels. During a disaster, the framework should emphasize a collaborative approach, seeking to integrate NGO capabilities into the broader response strategy through established coordination mechanisms, such as those within the National Incident Management System (NIMS) framework, while respecting the operational independence and unique contributions of each NGO. Question 17. Governance review demonstrates that the healthcare organization's disaster preparedness training and education program has been identified as an area requiring enhancement. Which of the following approaches best aligns with best practices for ensuring effective and compliant training in a healthcare disaster context? Option A. Rely primarily on generic, widely available disaster preparedness courses to fulfill training requirements, assuming they cover essential competencies. Option B. Focus training efforts on topics frequently requested by staff, regardless of a formal needs assessment or alignment with the organization's specific disaster plan. Option C. Implement a comprehensive, needs-based training program that includes regular assessments of knowledge and skills, development of relevant and evidence-based curricula, diverse delivery methods, and robust evaluation of training effectiveness. Option D. Increase the frequency of mandatory online training modules covering general disaster response principles, ensuring all staff complete them annually. The correct answer is C. Implement a comprehensive, needs-based training program that includes regular assessments of knowledge and skills, development of relevant and evidence-based curricula, diverse delivery methods, and robust evaluation of training effectiveness. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare disaster preparedness, ensuring that training and education initiatives are not only compliant but also effective in building a resilient workforce. The professional challenge lies in moving beyond a checklist approach to training and towards a system that genuinely enhances preparedness and response capabilities. This requires careful judgment to identify training gaps, assess the quality of educational content, and ensure that learning translates into practical skills and improved decision-making during crises. The effectiveness of training directly impacts patient safety and the organization's ability to manage disaster events, making this a critical area for governance oversight. Correct approach analysis. The correct approach emphasizes a continuous, evidence-based cycle of training needs assessment, curriculum development, delivery, and evaluation. This aligns with best practices in adult education and disaster management, as outlined by federal guidelines and professional healthcare disaster preparedness standards. Specifically, it reflects a commitment to 1. Identifying specific knowledge and skill gaps through regular assessments, scenario-based drills, and post-incident reviews. 2. Developing or adapting training materials that are evidence-based, relevant to the organization's specific risks and resources, and incorporate lessons learned from actual events or exercises. 3. Implementing diverse training methodologies, e.g., simulations, tabletop exercises, online modules, hands-on skills practice, to cater to different learning styles and ensure practical application. 4. Establishing robust evaluation mechanisms to measure the effectiveness of training, not just in terms of knowledge acquisition, but also in behavioral changes and improved performance during simulated or actual events. This iterative process ensures that training remains current, relevant, and impactful, thereby fulfilling regulatory requirements for preparedness and promoting a culture of continuous improvement. Incorrect approaches analysis, focusing solely on the frequency of training without assessing its relevance or effectiveness, represents a significant regulatory and ethical failure. This approach treats training as a compliance burden rather than a critical component of patient safety and organizational resilience. It fails to address whether the content is up to date, aligned with current threats, or effectively imparts the necessary skills. Prioritizing generic, widely available training modules over institution-specific disaster plans and protocols is also problematic. While foundational knowledge is important, disaster preparedness is highly context-dependent. Training must be tailored to the unique vulnerabilities, resources, and operational procedures of the healthcare facility. Generic training may not adequately prepare staff for the specific challenges they will face. Implementing training solely based on staff requests without a systematic needs assessment is inefficient and potentially ineffective. While staff input is valuable, it should be integrated into a broader, data-driven approach to identify critical gaps. This ad hoc method risks overlooking essential training areas or investing resources in less impactful topics, failing to meet the organization's overall disaster preparedness objectives. Professional reasoning. Professionals should adopt a systematic and data-driven approach to training and education for disaster preparedness. This involves 1. Conducting regular, comprehensive needs assessments that consider the organization's risk profile, past incidents, regulatory requirements, and evolving best practices. 2. Developing a strategic training plan that outlines learning objectives, target audiences, content, methodologies, and evaluation metrics. 3. Ensuring that training content is evidence-based, up-to-date, and directly relevant to the specific roles and responsibilities of healthcare professionals during a disaster. 4. Implementing a variety of training methods to engage learners and promote skill development and retention. 5. Establishing a robust evaluation framework to measure the effectiveness of training and use the findings to continuously improve the program. 6. Fostering a culture where learning from exercises and incidents is actively encouraged and integrated into future training initiatives. Question 18. Research into the aftermath of a major earthquake reveals a hospital overwhelmed with casualties. Emergency power is functioning, but the supply of ventilators is critically low, and the number of patients requiring mechanical ventilation far exceeds the available units. A physician must decide how to allocate these life-saving resources. Which of the following approaches best aligns with established disaster healthcare guidelines and ethical principles for patient care in such a crisis? Option A. Provide the highest level of care, including mechanical ventilation, to every patient who presents with respiratory distress, regardless of the overall demand or the availability of resources, to ensure no patient is denied immediate treatment. Option B. Allocate ventilators to patients with the highest likelihood of survival and recovery, prioritizing those who can be weaned off the ventilator relatively quickly, even if it means delaying care for some critically ill patients who may require prolonged ventilation. Option C. Cease all ventilator use for patients with severe, non-survivable injuries and reallocate those units to patients with less severe respiratory issues who have a higher chance of immediate recovery, even if their initial condition was not as critical. Option D. Prioritize patients based on their pre-disaster social status or perceived societal value, ensuring that individuals deemed most important to the community's recovery receive the limited ventilators first. Correct answer is B. Allocate ventilators to patients with the highest likelihood of survival and recovery, prioritizing those who can be weaned off the ventilator relatively quickly, even if it means delaying care for some critically ill patients who may require prolonged ventilation. Explanation. This scenario presents a significant professional challenge due to the inherent tension between established healthcare protocols and the exigencies of a disaster environment. The critical need to provide care under conditions of extreme resource scarcity, overwhelming patient volume, and potential infrastructure failure demands rapid, ethical, and effective decision-making. The professional challenge lies in balancing the principle of do no harm with the imperative to save as many lives as possible, often requiring difficult triage decisions. The correct approach represents best professional practice because it prioritizes patient safety and equitable care distribution within the constraints of the disaster. It aligns with the core principles of disaster medicine, emphasizing the need for a systematic and evidence-based approach to patient management. Specifically, it adheres to guidelines for disaster triage, which are designed to maximize the number of survivors by allocating limited resources to those most likely to benefit. This approach respects the ethical obligation to provide care while acknowledging the limitations imposed by the disaster, ensuring that decisions are made based on medical need and likelihood of survival, rather than arbitrary factors. An incorrect approach that focuses solely on providing the highest level of care to every individual, regardless of the disaster's impact on resource availability, fails to acknowledge the fundamental principles of disaster response. This would lead to the rapid depletion of scarce resources, potentially leaving many patients without any care and reducing the overall number of lives saved. It violates the ethical principle of justice by not distributing resources equitably in a crisis. Another incorrect approach might involve withholding care from certain categories of patients based on non-medical criteria, such as age or pre-existing conditions, without a clear, disaster-specific protocol. This is ethically indefensible and likely violates regulations governing patient care and non-discrimination. Such decisions must be guided by established triage protocols that focus on survivability and resource utilization, not subjective judgments. A further incorrect approach could be to cease all non-emergent care and focus exclusively on the most critically injured, even if less severely injured patients could be stabilized with minimal resources. This fails to recognize that effective disaster response involves managing a spectrum of patient needs, and that stabilizing less critical patients can prevent their condition from deteriorating, thus freeing up resources for those with the most severe injuries. The professional decision-making process for similar situations should involve a clear understanding of the incident command system and established disaster triage protocol. Professionals must be trained to assess patient acuity rapidly, understand resource limitations, and make swift, defensible decisions based on objective criteria. Continuous communication with incident command and adherence to pre-established plans are crucial. Ethical considerations, particularly fairness and the equitable distribution of care, must be integrated into every decision. Question 19. Strategic planning requires a healthcare facility to proactively identify and address potential threats to patient care and operational continuity. Considering the regulatory framework for disaster preparedness, which of the following approaches best exemplifies a robust strategy for risk mitigation in a healthcare facility? Option A. Focusing mitigation efforts exclusively on the most recent or most dramatic disaster event experienced by the region. Option B. Implementing mitigation strategies only when mandated by a specific, immediate threat from regulatory bodies. Option C. Developing and implementing a comprehensive, multi-hazard risk assessment and mitigation plan that is regularly reviewed and updated. Option D. Allocating the majority of the disaster preparedness budget to post-event recovery efforts, with minimal investment in pre-event mitigation. The correct answer is C. Developing and implementing a comprehensive, multi-hazard risk assessment and mitigation plan that is regularly reviewed and updated. Explanation. Scenario analysis. This scenario presents a professional challenge because healthcare facilities operate in a complex environment where the potential for disaster is ever present, ranging from natural events to technological failures and public health emergencies. Effective risk mitigation is not merely a procedural task, but a critical component of patient safety, operational continuity, and regulatory compliance. The challenge lies in balancing resource allocation, anticipating a wide spectrum of potential threats, and integrating mitigation strategies into the daily operations of a healthcare system, all while adhering to stringent federal and state regulations designed to protect public health and safety during emergencies. Correct approach analysis. The correct approach emphasizes the development and implementation of a comprehensive, multi-hazard risk assessment and mitigation plan that is regularly reviewed and updated. This aligns directly with the core principles and requirements of the National Healthcare Disaster Certification, which mandates a proactive and systematic approach to disaster preparedness. Best professional practice dictates that such a plan should identify potential hazards, assess their likelihood and impact, and then prioritize mitigation strategies based on this assessment. This includes physical infrastructure improvements, robust emergency communication systems, staff training and drills, and the establishment of mutual aid agreements. This approach represents best professional practice because it is evidence-based, scalable, and directly addresses the regulatory expectation of maintaining a state of readiness to respond to and recover from disasters, thereby safeguarding patient care and community well-being. Incorrect approaches analysis, focusing solely on the most recent or most dramatic disaster event without a broader risk assessment, is a regulatory and ethical failure. This approach is reactive rather than proactive and fails to address other significant, albeit less recent, threats that could still impact the facility. It demonstrates a lack of comprehensive planning, which is a cornerstone of disaster preparedness regulations. Implementing mitigation strategies only when mandated by a specific, immediate threat is another regulatory and ethical failure. This approach is insufficient because it neglects the continuous nature of risk management and the importance of pre-event mitigation. Regulations often require ongoing preparedness efforts, not just responses to imminent crises. This reactive stance can lead to delays in implementation, insufficient resources, and ultimately, a compromised ability to respond effectively when an event occurs. Allocating the majority of the disaster preparedness budget to post-event recovery efforts without adequate pre-event mitigation is a significant regulatory and ethical failure. While recovery is crucial, the primary focus of disaster preparedness frameworks, including those underpinning the National Healthcare Disaster Certification, is on mitigating the impact of an event before it occurs. Neglecting mitigation can lead to greater loss of life, increased patient harm, and more extensive damage, which are all contrary to the goals of disaster preparedness. This approach prioritizes damage control over prevention and resilience. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a thorough understanding of the regulatory landscape, specifically the requirements for the National Healthcare Disaster Certification. This involves conducting a comprehensive, multi-hazard risk assessment that considers both the likelihood and potential impact of various disaster scenarios relevant to the facility's geographic location and operational context. Following the risk assessment, mitigation strategies should be prioritized based on their potential to reduce the identified risks. This prioritization should be informed by cost-effectiveness, feasibility, and regulatory mandates. The chosen strategies must then be integrated into the facility's overall emergency operations plan, with clear roles, responsibilities, and resource allocation defined. Regular training, drills, and plan updates are essential to ensure ongoing readiness and to adapt to evolving threats and regulatory guidance. This iterative process of assessment, planning, implementation, and evaluation is critical for maintaining a robust and compliant disaster preparedness program. Question 20. Risk assessment procedures indicate a potential for a novel, highly contagious respiratory pathogen to emerge, posing a significant threat to public health and overwhelming local healthcare capacity. Considering the definition and scope of disaster management within the National Healthcare Disaster Certification Framework, which of the following best characterizes the appropriate inclusion of this emerging threat? Option A. This emerging pathogen should be integrated into the healthcare facility's disaster management plan, as it represents a potential event that could overwhelm normal operational capacity and necessitate a coordinated, large-scale response. Option B. This emerging pathogen should be addressed solely through routine infection control protocols, as disaster management is typically reserved for events with a high historical frequency and immediate, predictable impact. Option C. This emerging pathogen falls outside the scope of disaster management unless it has already caused a declared national emergency, as disaster management is reactive to officially recognized catastrophic events. Option D. This emerging pathogen should be managed as a public health issue by external agencies, with healthcare facilities only needing to implement standard patient care protocols without specific disaster preparedness measures. The correct answer is A. This emerging pathogen should be integrated into the healthcare facility's disaster management plan, as it represents a potential event that could overwhelm normal operational capacity and necessitate a coordinated, large-scale response. Explanation. The scenario presents a challenge in defining the scope of disaster management within a healthcare setting, specifically concerning the integration of emerging threats. Professionals must discern which elements fall under the purview of disaster management, as defined by relevant regulations and guidelines, and which might be considered routine operational challenges. The core difficulty lies in distinguishing between a predictable, manageable operational issue and a low-probability, high-impact event that necessitates a disaster response framework. The correct approach emphasizes a comprehensive understanding of disaster management as encompassing preparedness, response, and recovery for events that overwhelm normal operational capacity. This aligns with the National Healthcare Disaster Certifications focus on ensuring healthcare facilities can maintain essential functions and protect patients and staff during extraordinary circumstances. Regulatory frameworks typically mandate proactive risk assessment that includes a broad spectrum of potential hazards, from natural disasters to technological failures and public health emergencies. Identifying and planning for these events, even those with low historical frequency but high potential impact, is a cornerstone of effective disaster management. An incorrect approach would be to narrowly define disaster management based solely on historical occurrences or easily quantifiable risks. This fails to acknowledge the dynamic nature of threats and the regulatory imperative to prepare for a wide range of contingencies. For instance, excluding novel infectious diseases or cyber attacks from disaster planning because they haven't previously caused widespread disruption in a specific facility would be a significant regulatory and ethical failure. It neglects the principle of all hazards preparedness, which is fundamental to disaster management certifications. Another incorrect approach might be to conflate disaster management with routine emergency response protocols. While related, disaster management involves a higher level of coordination, resource mobilization, and strategic planning that extends beyond immediate incident containment. Failing to differentiate these levels can lead to inadequate preparation for large-scale events. Professionals should employ a systematic decision-making process that begins with a thorough review of the National Healthcare Disaster Certification scope and objectives. This involves understanding the definition of a disaster within the context of healthcare operations, an event that disrupts normal functioning and poses a significant threat to patient care, staff safety, and facility integrity. The process should then involve a multi-hazard risk assessment that considers likelihood and impact, utilizing established frameworks that encourage forward thinking and the inclusion of emerging threats. When faced with ambiguity, professionals should err on the side of inclusion, ensuring that potential threats are evaluated within the disaster management framework, rather than excluded due to a narrow interpretation. This proactive and inclusive stance is essential for meeting regulatory requirements and upholding ethical obligations to protect public health.